Hello, you're watching the Daily Report for Wednesday, March 2nd. I'm in Sanhee. There has been a host of changes in pandemic-related guidelines here in the country, even as authorities have announced yet another record high in daily infections. I have Kwon standing by with the actual numbers. So just start us off then.
Sure, Sunny. Korea has surpassed 200,000 COVID-19 infections in a day, which is an all-time high, as you just mentioned. So let's take a closer look at the exact figure. 219,241 cases were tallied as of 12 a.m. this Wednesday. And apart from 68 imported cases, most of these are domestic transmissions. And the daily average in the past week now has surpassed 166,000. And today's figure marks an increase by roughly 80,000 infections from the day before. And if you compare the figure to last Wednesday, it is an on-week jump by almost 50,000 new cases. And for a closer look at the infections by region, Gyeonggi province has seen the highest daily infection number with over 68,000. And with that, Gyeonggi province has surpassed 1 million accumulated cases. And then followed by the capital Seoul with close to 47,000 infections. Other places with five-digit figures are Incheon, Busan, as well as Gyeongsangnam-do province. And Sejong City, meanwhile, surpassed 20,000 infections in total as of this Wednesday. And if we take a closer look at the total number of cases, now close to 3.5 million infections here in the country, and 8,266 COVID-19 related deaths, with 96 more people having lost their lives in the past day. And with that, the average number of deaths in the past week stands at around 94. Also, the number of patients in severe or critical condition has been going up again, now standing at 762, and that's in the 700s for the third consecutive day. Moving over to our vaccination figures, as Tuesday was a national holiday here in the country, we only had a triple-digit number of people who got their first or second dose. If we go over to our booster shot campaign, we've got a little over 4,700 who got their additional shot on Tuesday, and that's now 31.5 million of the nation's population. Globally, around 1.7 million new cases were tallied in the past day as of noon Korea time, with a little over 8,800 fatalities. And there's been a grim milestone here in Japan, which has hit 5 million cases in the past day. And Spain surpassed 11 million infections. Meanwhile, South Korea now has become the country with the 27th highest caseload in the world. And those are the general updates I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, as mentioned earlier, Korea's daily tally has hit above 200,000. Authorities, for their part, have called for a calm and cautious approach to the current situation. For more, I have Kim Bo-kyung here in the studio. Bo-kyung, welcome to the program.
Thank you for having me, Sunny.
Right, let's begin with this unprecedented number of new infections here in the country, Bo-kyung.
Well, Sunny, South Korea has reported more than 200,000 cases in a single day for the first time in more than 2 years since the country's very first COVID-19 case on January 20th, 2020. The number is around 30% higher than the previous record from February 23rd of 171,451 infections, and well over double the figure from 2 weeks ago, that is February 16th, at 90,439. Health authorities said more than 1 million PCR tests were conducted on Tuesday, and around 720,000 of these were carried out at temporary screening centers, which are both record highs. Korea's test positivity rate also went over 40% for the first time on Tuesday, yet another indication that the Omicron variant is fast spreading across the country. Despite the latest surge, the Korean government says there is no need to panic and asked the public to remain calm.
We are fully prepared to fight the Omicron variant. We have revamped our prevention and medical systems to minimize the number of critically ill patients and deaths. We have secured more than 2,700 beds for severely ill patients, and our ICU occupancy rate is hovering at around 50%, while our fatality rate is being kept at a low level thanks to the country's high vaccination rate.
Right, and speaking about vaccination, Po-kyung, vaccine pass requirements have been lifted at public venues as of yesterday. That would be the 1st of March. What has been the response to this lifting?
Well, Sunny, vaccine passes were scrapped at 11 types of public venues on Tuesday, including restaurants and cafes. Though business owners were skeptical about its impact on revenues, given that social gathering caps and 10 p.m. shutdown orders remain in place, they welcomed the change for removing the hassle on staff and customers. However, some experts have criticized the move, saying it may be premature given the worrying spread of the Omicron variant.
There are some who do not know that they don't have to use their vaccine pass, but as time goes by, people will come in comfortably and have a meal.
It is quite concerning that lifting the measure could burden medical staff and health facilities while the country is going toward the peak of the pandemic.
Well, regarding this, the government said the move was necessary in order to concentrate its resources on the care of critically ill patients while stressing the importance of getting vaccinated.
We ask for your understanding on this decision, as the country needed to focus on managing high-risk groups by easing the burden on our public health centres. But we again would like to stress that the temporary suspension of vaccine passes does not in any way diminish the importance of vaccinations.
Right, so vaccinations remain important, of course. Meanwhile, the academic arena here in the country, Po-kyung, kicked off its new year earlier on this Wednesday morning, right?
That's right. Today is the first day of the new semester for most of the schools, and the Education Ministry has previously recommended that schools nationwide provide full in-person classes. It calls for the adoption of remote learning if 3% of the student body tests positive or 15% go into quarantine due to infection or close contact. However, with the recent surge in mind, the ministry has allowed a 2-week grace period from March 2nd to 11th, so schools can decide on their own whether to hold in-person or virtual classes. During the spring semester, schools will not penalize students for COVID-19 related absences, but students are required to submit test results or a note from their doctor if they cannot take their midterms or final exams. The ministry's guidelines recommend students take 2 rapid antigen tests a week and are providing more than 60 million rapid antigen test kits for nearly 7 million students and staff at kindergartens, elementary, middle, and high schools. They can use a mobile app to share their health conditions and test results with schools, but it is not mandatory. Meanwhile, starting on the 14th, even unvaccinated students living with a person who has contracted COVID-19 will be allowed to attend in-person classes. Currently, only vaccinated students can go to school, while the unvaccinated have to stay home for 7 days. While the rule has changed, students living with a COVID-19 patient are recommended to take a PCR test within 3 days of their cohabitants testing positive, and a rapid antigen test on the 6th or 7th day.
Right, so proactive testing remains very important. All right, Po-kyung, then, thank you for that coverage.
Thank you.
Right, up next, we have the latest government assessment, Soa, of the COVID-19 situation here in the country, right?
Right, Sunny. Now, although daily infections at above 200,000, this does mark a milestone, as Po-kyung explained, but it also gets us closer to the peak of the Omicron wave, which we have to overcome. And here's an official saying that Wednesday's caseload actually represents a decline in the rate of increase. But he also added this to this remark.
This is only a single-day figure, so we have to see how the situation will develop as we head further into the week, in order to determine whether the slowing pace and the rise of our case counts is part of a clear trend or an outlier. Further observations will allow us to make a more objective evaluation of the degree in which infection rates are slowing and provide an important basis in forecasting the peak of our outbreak.
Regarding the expected number of daily cases during the peak, Son said the government is sticking to its most recent projection that it made on Monday. That will be KDCA Commissioner Jung Eun-kyung's forecast of more than 230,000 cases by the 9th, so next Wednesday, with more than 1,200 patients in critical or severe condition and up to 350,000 infections between early and mid-March. Son Young-nae meanwhile added this Wednesday that it's difficult to make a prediction on how long the peak will last, as there are some countries that experienced a sudden plunge following their peak, while others continue to see high figures for some time. And in the latter case, that would be countries like Germany, and the US, for instance, is a country where a sudden dip was experienced after the wave.
Right, I see. Meanwhile, back here in the country, I understand authorities have also shared more information about voting protocols for COVID-19 patients who wish to partake in the presidential election, Soa.
Right, Sunny. So following the recent passage of a bill to permit these people to leave their homes to vote for their next president, health authorities unveiled details on the procedures this Wednesday. And COVID-19 patients and people in self-isolation can vote on Election Day if we take a look at those details, which is next Wednesday on March 9th, as well as on the second day of early voting on March 5th, so this Saturday. They can cast their ballots in a specific time frame, which would be 6 p.m. to 7:30 p.m. on the 9th, and on the 5th, they can leave their homes or quarantine sites at 5 p.m. and must arrive before 6 p.m. at the polling station. That meaning actual voting may take place after 6 p.m. They just have to be there at the station by 6. People subject to this special voting will have to submit their ID cards as well as a text message they are to receive from the government. A health ministry official also addressed concerns regarding people who get infected with COVID-19 on Election Day. Let's take a listen.
It may be difficult for polling station workers to immediately determine if a voter may have contracted the virus on the day of the election. Therefore, we will maintain an emergency contact network to notify voters who may have been affected through community health centers and the KDCA in case they haven't been informed on the same day.
And Sunny, some people might be asking, what about the patients that are in severe or critical condition? As I mentioned before, that number could be at around 1,200 on Election Day. Now, officials say that depends on whether these patients are allowed to leave the hospitals or not. So the rights for voting will be there, but patients that are staying in ICU beds are in such a critical condition that it's probably difficult to actually leave the hospital. So it will be similar to other patients, not only COVID-19 patients who are in such a condition. So it's highly likely that they won't be going to the voting stations.
Right, I see. Finally, so I understand officials have also called for extra caution among the elderly in the absence of vaccine pass requirements.
Right, Sunny. Officials expressed their concerns regarding not only the elderly, but also other people who might be hesitating to get their additional or booster shots, as public venues won't be asking for your proof of vaccination anymore. So unvaccinated people as well as elderly who have either not been vaccinated or haven't received their booster shot will have to take extra care when entering public spaces. An official once more stressed how the death rate for the Omicron variant is only similar to the seasonal influenza when completely vaccinated, but that among unvaccinated seniors, Omicron's fatality rate stands at above 5%. Meanwhile, in-person visitations to nursing hospitals and nursing homes remain forbidden for the time being, and senior welfare centers remain closed to prevent transmission among those at highest risk. Only online activities are in operation since mid-February. So with that, officials noted that the suspension of the vaccine pass system does not affect these specific venues for seniors. And also officials reiterated that for now, the suspension of the temporary vaccine pass system remains temporary unless we have a new variant, for instance, emerging that might be even leading to more severe cases than the Omicron variant.
But hopefully that will not be the case then.
Right, let's hope so.
All right, so thank you for the updates.
My pleasure.
In our headlines at this hour, we begin with news of rampant bloodshed over in Ukraine as Russia's military assault now targets civilian regions. Om Jung reports.
On the sixth day of Russia's invasion of Ukraine, Russian forces hit the cities of Kyiv and Kharkiv. Some Ukrainian TV channels reportedly dropped off air after Russia struck Kyiv's main TV tower as Moscow attacked civilian areas in what is being seen as a bid to demoralize Ukrainian resistance. The cultural heart of Ukraine's second largest city, Kharkiv, was also struck by missiles and rockets. In the city's landmark Freedom Square, an opera house, concert hall, and government offices were bombed, causing a huge fireball that blew out the windows of nearby buildings. Residents claimed they were purposely being shelled by Russian forces.
They bombed a residential building, hit it with rockets. Many civilians died. I have videos of at least 4 dead people lying on the ground. The dead person is lying next to us.
Local officials say at least 20 people died during Tuesday's attack on the northeastern city of Kharkiv. The UN Human Rights Office says at least 136 Ukrainian civilians have been killed since Russia started its assault on Ukraine, but estimates vary depending on the source. Ukraine's President Volodymyr Zelensky says Russia's bombardment of his country should stop.
We are for dialogue. Yes, but the least that must happen is the bombardment of people must stop. You simply have to stop the bombardment and then sit down behind the table for talks.
Russia's TASS news agency, quoting a source on the Russian side Tuesday, reports that a second round of Russia-Ukraine talks is planned for Wednesday. The first round of talks on Monday lasted about 5 hours but did not produce any tangible results. On Tuesday, U.S. President Joe Biden held another phone conversation with President Zelensky, discussing Washington's economic and security support as well as humanitarian aid to Kyiv. 엄지영, Arirang News.
And while international aid to Ukraine continues, international censure of Russia is also growing. In fact, sports authorities are taking steps to keep Russia out of the arena. Song Yujin explains.
While Russia intensifies its attack on Ukraine, sanctions and bans imposed by the international community are also escalating. In line with countries' efforts to isolate Russia from the global economy with biting sanctions, the sports community is stepping up to sideline Russia and ally Belarus from the playing field. The International Olympic Committee was the first to make a move. In a statement released on Monday, the IOC advised international sports federations and sports event organizers to bar the participation of Russian and Belarusian athletes and officials from their events. The IOC also decided to withdraw the Olympic order given to Russian President Vladimir Putin in 2001, citing as, quote, extremely grave violation of the Olympic truce. This comes just 3 days after the IOC recommended against holding any sports events in Russia or Belarus. Following the IOC's decision, gymnastics, judo, and volleyball matches slated to take place in Russia were canceled. And with only a few weeks left to its World Championships, the biggest sports event after the Olympics, the International Skating Union also announced on Tuesday that all Russian and Belarusian athletes will be banned from competing, adding it will take additional steps if needed. The situation is no different in soccer, where qualification for the 2022 World Cup in Qatar is still in the balance. Russia has now seemingly lost its shot for a slot in the world's most prestigious football tournament. FIFA, the organizer of the event, announced a joint decision with UEFA on Tuesday, suspending all Russian national and club teams from both FIFA and UEFA competitions until further notice. All in all, the backlash against Russia's invasion is now reaching over to the world of sports as well. 송유진, Arirang News.
Also, in a show of solidarity, member nations of the global energy entity have agreed to tap into their reserves in response to soaring oil prices amid Russia's invasion of Ukraine. Kim Yo-san has details.
31 member countries of the International Energy Agency have agreed to release 60 million barrels of oil from their strategic reserves. That includes 30 million barrels from the U.S. alone. The agency claims this will send a strong message to oil markets that there will be no shortfall in supplies resulting from Russia's invasion of Ukraine. However, this is equivalent to less than a single day of global oil consumption. The IEA, which includes the US, Germany, Japan, and Canada, holds 1.5 billion barrels of emergency stockpiles. This is the fourth time in history that the agency has engaged in coordinated action since the reserves were established in the wake of the Arab oil embargo in 1974. White House Press Secretary Jen Psaki said the move is another example of how partners around the world are condemning Russia's invasion and how they are working together to address the impact of President Putin's war. Despite such measures, oil prices surged 7% on Tuesday to their highest level since 2014. U.S. West Texas Intermediate crude rose 8%, topping $103. This is its highest close since July 2014 and the biggest daily percentage gain since November 2020. Brent futures also jumped more than 7% to settle at nearly $105 a barrel, their highest close since August 2014. Kim Yo-sun, Arirang News.
Here on the local front, statistics for the month of January show a decline in Korea's industrial output and consumption for the first time since March 2020. Our Min Soo-kyun has more on these findings.
South Korea's overall industrial production in January saw its biggest on-month fall in 6 months. Data from Statistics Korea on Wednesday shows that the country's industrial output edged down 0.3% on month from a 1.3% gain in December. This marks the largest fall since July last year. The agency attributed the fall to slower production in the service industry due to the latest surge in COVID-19 cases. Retail sales, a barometer for consumer demand, also saw a steep fall of 1.9%, posting its biggest on-month decline in 18 months, led by dwindling demand for cars and clothes. It's the first time in almost 2 years that industrial output and retail sales have both plunged at the same time. Statistics Korea explained that the downturn in industrial output and retail sales was attributed to the previous month's high base effect.
The index in major indicators last month was quite high, so this month, although the figures were not that bad, they appear to have been relatively affected.
Meanwhile, facility investment rose 2.5% from a month earlier, following more investments in transportation equipment. Despite some flattering numbers in January, Statistics Korea believes that the economic recovery momentum remains intact. On a separate note, Finance Minister Hong Nam-gi also stressed that the country has extended its economic recovery despite the fast-spreading Omicron variant. But the minister did express concern over heightened economic uncertainties due to the Russia-Ukraine crisis. He said the government will actively monitor and manage both internal and external risks to mitigate any economic fallout. Min Soo-kyun, Arirang News.
Let's take a look at what's going on in the world now. Over in Chile, firefighters have been battling back blazes in Valparaiso on Monday going into Tuesday, with the region now on red alert over raging wildfires. Local officials say strong winds in the area are fueling the movement of the fires, which are consuming hundreds of hectares of land. The geographical location of the fires is also concerning, as they could threaten electrical substations, roads, and many towns in the area. Helicopters and airplanes have been working alongside 18 brigades to extinguish the wildfires before they reach some of the more populated areas. In recent weeks, firefighters across the country have been struggling to manage wildfires amid an intense heat wave. A national conference in Burkina Faso has adopted a charter that will allow the military junta that seized power in the West African state in January to lead a 3-year transition. The charter was later signed by junta leader Henri Paul Damiba on Tuesday. The commission that drafted the transitional charter had initially proposed a 2.5-year transition, saying the junta called for around 2 years to stabilize the country and organize elections. The January coup was the fourth in the West Africa region in 18 months, as Burkina Faso was suspended from the Economic Community of West African States and the African Union. The U.S. has also halted nearly $160 million in aid. The United States returned a total of 9 trafficked antiquities to Jordan during an official ceremony in Amman on Tuesday. The artifacts were illegally smuggled from Jordan and obtained by an antiquities collector in the U.S. before being recovered by the U.S. Department of Homeland Security. Among the returned items include Neolithic stone animal figurines, a stone altar, tombstones, a human figurine, and a bronze pitcher. During the ceremony, Jordan's Minister of Tourism and Antiquities stressed the deep U.S.-Jordanian relations, mainly in combating trafficking of cultural property. Just over a week after testing positive for COVID-19, Queen Elizabeth II felt well enough to take part in 2 virtual audiences on Tuesday, following a number of cancellations of similar events last week. The 95-year-old was reported to have been suffering mild cold-like symptoms, and despite canceling some events, she continued with light duties. During her video link from Windsor Castle, she spoke with incoming ambassadors from Andorra and Chad, while the ambassadors attended the virtual session at Buckingham Palace. Buckingham Palace noted that it would not be giving a running commentary on the condition of the Queen after her infection. Lee Seung-jae, Arirang News.
The wearing of face masks amid the pandemic has led to a rather interesting consumption pattern driven essentially by one sense of smell. We explain in this following report.
You know, we can never forget about face masks anymore because of the pandemic. But have you realized that people have become more sensitive to smells?
With the wearing of face masks now becoming the norm, more of us are noticing the smell of our breath. In fact, since the pandemic, the demand for breath-freshening candies, particularly mints, has increased. Toothpaste is also among the popular bad breath remedies. Increased anxiety about bad breath has caused more people to suffer from halitophobia, which is a severe fear of bad breath that does not exist.
한 해 6,000명 정도 환자분들이 병원을 찾고 있는데요. 이분들 중에 30%는 구취 공포증이라고 볼 수 있습니다. 이 구취 공포증이 발생을 하면 강박적인 그 구강 세정 행동으로 이어질 수 있기 때문에 주의가 필요합니다.
A simple test to find out whether you have bad breath is to lick the inside of your wrist with the back of your tongue. If your wrist smells unpleasant, it's likely your breath does too. Also, if you visit a hospital, it gives you an oral check, which measures level of the 3 major substances that cause bad breath. The best way to get rid of bad breath is to keep your mouth clean. Brushing your teeth at least twice a day, if possible, after every meal is highly recommended. Bad breath is usually caused rather by white coating on the tongue, not teeth, so don't forget to brush your tongue gently too. There are mask refresher patches though. Caution should be taken in using them as there are no sticker-type air freshener manufactured or imported through legal procedures.
By the way, bad breath is not the only thing people began to care about. In fact, sales of fragrance-related products are booming, even despite mask mandates.
In fact, perfume sales at Jeju Airport grew 92.73% over the past 2 years. Along with the booming perfume sales, perfume-making workshops are also gaining popularity. It attracts many young people as you can make your own one-of-a-kind perfume there.
요즘 코로나 때문에 좀 우울하기도 하고 그래가지고요. 이색적인 경험을 하고 싶어서 찾아오게 됐습니다. 그냥 제가 맡았을 때 기분이 좋고 다른 사람들도 맡으면 기분 좋으라고 이렇게.
After the pandemic, those who want look for scents that they like visit perfume workshops.
코로나 때문에 마스크를 쓴다든지 하니까 불편하고 이런 그 클래스를 진행하는 과정 중에 힐링되는 감정을 느끼고 하니까 전보다 코로나보다 더 훨씬 많이들 오시고 있습니다.
Since COVID-19, many people have also been looking for eco-friendly fabric softeners without microplastics or pigments and scented hand sanitizers. Because people have difficulty going outside due to the pandemic, they are trying to relax and refresh themselves indoors, surrounded by great scents. Oil extracted from natural ingredients is helpful for relaxing your body, but caution is needed when using products made of chemical substances.
방향제나 향초에서 나오는 화학 물질들이 인체에 그렇게 도움이 되는 물질들이 아닙니다. 자칫하면은 호흡기에 심각하게 피해를 일으킬 수가 있습니다. 그 실내 공기를 깨끗하게 바꿔주는 환기를 하는 노력이 반드시 있어야지 되고.
In particular, burning fragrance products can harm your lung health as they emit fine dust and carbon dioxide. Hence, caution as well as proper ventilation are needed. Of course, as part of efforts to prevent COVID-19 as well. So we used to be surrounded by various smells, but that is hardly the case because of masks. But instead, now we are finding ourselves at places where great fragrances are attracting us to. This has been 신새벽.
Vaccine pass requirements have been lifted, and even those unvaccinated residing with a COVID-19 patient are exempt from quarantine as long as they test negative. For more on the latest ease in COVID-19 restrictions and its potential impact in addressing Omicron, I have Dr. David Kwak from Suncheon University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
I also have Dr. Alice Hyung-Tan at Miss Medi Women's Hospital live on the line. It's good to have you on, Dr. Tan.
Always a pleasure.
Meanwhile, over in Canada, I have Dr. Daryl Falzerano at the Vaccine and Infectious Disease Organization. Dr. Falzerano, it's a pleasure to have you with us.
It's a pleasure to be here tonight.
Right. Dr. Kwak, let's begin with your understanding, that is, of the government's decision to grant a greater sense of autonomy to members of the public in efforts to address Omicron.
Well, so as the KDCA has made a formal statement already, I think they're trying to allocate resource-heavy duties to that's what's more needed currently. So instead of allocating these governmental workers to take care of all these mild cases and also to govern over the people who are to keep their eyes on whether or not people are actually keeping social distancing, I think they're trying to really heavily allocate these human resources to those people who might need their hands, such as those people who are immunologically weakened or those people who might have a better chance to become more severe from the illness. I think there's also an issue with such method as vaccine passes of equal opportunity. So if it was implemented to different venues and businesses, we face an issue of what would benefit from the vaccine passes and which kind of venues did not so much benefit from it. So I think overall they considered that the vaccine passes or much stricter, harsher social distancing did not really benefit in overall senses of keeping transmission preventable in a sense because it's also spreading widely anyways. So the government has made the decision to really discard all the harshest harshest and strictest social distancing for the time being may need to focus their focus on those people who need the care most at the moment. And I agree partly with their decision, being careful though, because the fire is in its full amount right now. We have no ways of really just suddenly cutting it down. So we better really focus on whom we can protect even better from this point on.
Right. And Dr. Tan, as part of the latest shift in COVID-19 restrictions here, those unvaccinated, as I mentioned earlier, living with a COVID-19 patient are free to engage in their daily activities if they test negative. What precautions do you care to highlight?
Well, first of all, as you said, people need to test. There is a testing requirement. So the first test needs to be a PCR test. And then during the 7-day active surveillance period, they will be checking their health status twice a day, morning and night, to see if they develop any symptoms of COVID-19. And at the end of the test of the active surveillance period, they have to test again. And at that time, it's a rapid antigen test. Now, the risk of COVID in our country is quite high right now. According to the New York Times, our country ranks 7th in the world for the incidence of COVID-19 per 100,000 population. The secondary household attack rate for COVID-19 in our country, according to the KDCA, and this was reported actually in the March issue of Emerging Infectious Diseases of the US CDC, is actually 50%, which is quite high, but it's not 100%. So there are things that you can do if a household member has been diagnosed with COVID. First of all, everyone needs to wear a KF94 mask at all times. There should also be a separation in living space between the affected or the infected person and the rest of the household, including they should be using a separate bathroom, they should be eating in a separate place and spending their the most of their time in a separate space. Ventilation is very important. All the windows of the house should be open for at least 10 minutes, 3 times a day. And if you can get a cross current in your house by opening windows in opposing walls, that's actually better. If you can use a HEPA air filtration system, that will also help. Disinfecting household surfaces with either a disinfectant spray or a disinfectant wipe is also very important. And it's also, you have the responsibility of making sure that you do not inadvertently spread COVID-19 to others. So even if you are not under strict quarantine, it's only active surveillance, you should try to, if you can, test yourself before leaving the house with a rapid antigen test. Also limit the amount of time that you're spending in the community to 2 hours per day. Limit your activities to those that are only essential activities. And then, of course, do not spend time in public spaces and do not visit places where people who have high risk of developing severe disease due to COVID reside or are active. In other words, places like nursing homes or care centers for people with disabilities. Please do not go to these places. And this actually applies not just during the active surveillance period of 7 days, but also for 3 days after that period. So for 10 days, do not go into these high-risk facilities.
Right. Meanwhile, Dr. Falzerano, I understand several provinces over in Canada have recently announced a rollback of pandemic restrictions given the steady decline in the number of infections there. Could you tell us a bit more about this?
Yeah, so depending on where you live in Canada, restrictions are starting to lift. So mandatory masking restrictions are being lifted. The need to present a proof of vaccination to enter a facility, that is going away. And as well, some of the self-isolation rules. So if you're in contact or even if you're COVID positive, the mandatory 5-day self-isolation rules are going away. And it's up to the individual to make a responsible decision as to whether or not they self-isolate. This isn't being done blanketly across Canada, so it's up to the provinces to set the health guidelines. And And so it's not the same in every province, and they're not being rolled back at the same time. So some provinces moving sooner than others. The province I live in has lifted essentially all restrictions as of yesterday.
Right. Dr. Falzarano, what are your thoughts personally on the wisdom of abolishing, let's say, the mandatory isolation period for COVID-19 patients?
So that people are still highly encouraged to self-isolate. And really, that was never enforced before, right? There was a public health order saying that that's what you should be doing, but there is no people enforcing those regulations or that isolation period. So people should continue to self-isolate and do so to protect others. And that's largely how the whole approach is going. So it doesn't mean you can't wear masks places where you think that there's a higher risk. You're still allowed to do that. Businesses are still, letting their employees be masked. You can wear a mask into businesses. It's just that it's more loose. There's more freedom to do what you want. And I guess it's really going to be an experiment to see how it goes over the next probably 2 to 4 weeks to see what happens in terms of overall case numbers.
Right. Meanwhile, Dr. Kwok, many agree that Korea itself has yet to hit its Omicron peak. And that being said, do you see the latest lifting of COVID-19 restrictions here in the country as perhaps affecting the timing and scale of our Omicron peak?
Well, I'm pretty sure it would. Any sort of changes in the social distancing guidelines would definitely have an impact on the speed of the transmission, because obviously without such harsher restrictions, more people are going to come into exposure from the virus, and also there'll be more chances for whoever the generation or whoever the people might be to become ill from it. So I think in any case, I think the easing of the restrictions could possibly bring forth the peak at the time, which was speculated to happen in mid-March, but I'm pretty sure KDCA also had that in mind when it made the statement that they expected to see the peak in mid-March. There are other projections made by different affiliates which projected quite possibly that we've had actual peak of the actual cases back in late February, but instead the detection number, we could hit the peak in about 6th of March. I'm dearly hoping that by this week we would hopefully go over the peak and we will start to decline. But another fact that we have to consider is that roughly in any other countries that overcame the peak already, took about the same amount of time from the peak to really go down to the numbers that they used to have really low before being hit with the Omicron variant. If that is the case, that's about to happen in Korea as well. We took at least, this is about the 6th week that we're going into from the beginning of the Omicron wave. So if we were to hit the peak this week, let's say, it's going to take another 6 weeks to 7 weeks for us to actually go back down to the lower numbers. So all in the while, we keep going to have these patients come up with illnesses from COVID-19, let alone quite possibly severely ill patients from COVID-19. I believe the Korean government is currently saying that we have to about 2,000 units of capacity to take care of ICU bed patients. From a couple months ago, we had a huge problem filling people in the ICU beds when we had about we were hitting about 800 to 900 people back then. We were met with the huge consequences back then. People were dying because they couldn't get into hospital. I'm not entirely sure how, so we have reached about 1,000 more bed units by now. But if while we're still in here, we really need to heavily focus on how we're going to manage once we also start to see a steep rise in the numbers of patients who become severely ill from COVID-19, because that's about to happen very in the near future.
Right. And back in Canada, Dr. Falzarano, do you believe the country has passed its Omicron peak? And if that is the case, how does the ease in restrictions there look to affect containment efforts in the future?
So I think that is one thing that we can confidently say at the moment, that it does appear that we are past our peak. So the peak in cases would have been in early to mid-January. A peak in deaths attributed to COVID-19 followed in early February, and then case numbers have trended down since then. And the matching data, wastewater testing is also trending down. Hospital admissions are decreasing. However, we still have 6,000 cases today with an 11% positivity rate. And really, we've just fallen down to a level from being very high to just under previous peak levels. So there's still a lot of Omicron transmission, Omicron cases in the community, and that's why the lifting of the restrictions at this time, while we are in a much better spot than we were 2 months ago, it's really going to, how tolerant we are to how well this is going to work is going to play out over the next, 1 to 2 months.
Right, only time will tell then. Dr. Tan, some medical experts here say the government's recent actions are premature. What are your thoughts? And given the latest events, what do you propose to better prepare for the possible risks ahead then?
Well, given the fact that we've not actually peaked yet, it does feel premature to me. In terms of what's going on, basically the burden of responsibility for protecting ourselves against COVID-19 has been shifted from government mandates and restrictions to individual choices and behaviors. And so what can we do? Basically, I think education is one of the most important tools still that we can use against COVID-19. We need to educate the people on what the risk level is for getting infected. And as I said, in Korea right now, the risk level is very high. We also need to educate people in terms of what are they risking in terms of the full spectrum of disease. Yes, there are many people who are just going to have mild or asymptomatic disease, but there are many people who are going to be very uncomfortable during acute COVID, and they also risk what we talked about last time, chronic COVID. And we now know that there are higher risks of developing cardiovascular disease, stroke, and diabetes after complete recovery from COVID. And so these are long time risks. This is a legacy of COVID that we need to be aware of. As our other panel members have stated, just because the government doesn't mandate certain things anymore, it doesn't mean that you can't still do them. If you're going to go into a public space, there's nothing stopping you from asking the proprietor, the owner of the business, hey, have all your employees gotten vaccinated? Are they boosted? There's nothing stopping you from asking your friends before having a gathering, hey, are you all boosted? There's nothing stopping you from having your own personal policies to safeguard yourself and your family against COVID-19. And I know that's what many people are actually doing. Even if the government doesn't require it, we know how to keep ourselves safe. And there's no reason why you as an individual can't keep on doing these measures to stay safe and protect your family.
Right. Dr. Tan mentioned boosters. Dr. Kwak, starting this week, second booster shots are being offered to those who are immunocompromised here in the country. What are your thoughts on the efficacy of these additional shots?
Right. Sorry.
No, that's fine. I was just going to ask you about the efficacy of these fourth doses here in the country.
Right. So we're mainly talking about fourth doses, and I want to iterate that these are not being given to just normal, healthy people walking around on the streets. I realize that there have been many debates about whether or not the fourth shot was really needed to protect people from transmitting the virus. But let's focus that the fourth shot given here is not to really stop the transmission, but rather to protect those who are immunocompromised. These are people who are less likely than others to build as strong of an immunity from the same amount of dosages that other people have received to fight against COVID-19. So these are the people who have greater chances to become more severely ill or possibly even die from the disease if they are to be exposed to the virus. The debate was mainly about whether or not the normal people, healthy people, could benefit from fourth shot. And it was several different studies showed up that different results, but mainly it resulted in results yielding people not clearly benefiting from the fourth shot. But this, and I want to repeat myself, are not the healthy people walking on the streets. They are immunocompromised people. So I believe the fourth shot would definitely benefit them in regards to protecting them from possibly, after being exposed to the virus, creating a severe illness from it.
Right. And Dr. Falzerano, what has been the impact of the second booster shot for the public over in Canada?
So again, we've deployed them the same way that's being deployed in South Korea, where it's highly vulnerable populations, immune-suppressed, elderly, high frailty, and people in care homes who are being offered fourth doses. And these people are actually 4, 5, and 6 months out from their third dose in facing an Omicron wave. And so at the moment, the data seems to support that they are continuing to be protected from severe illness. Not, of course, from infection, as we know with Omicron. Unfortunately, the vaccines are not being very effective at doing that. But that's not always the goal, right? So the goal really should be protection from severe illness. So in that case, it does seem to be hitting that metric.
Right, well, that is good to know. Dr. Dan, the new academic year began today on this Wednesday here in the country, and the vaccination rate among those aged 13 to 15 reportedly stands at 71%. How do you assess this finding, and what are your thoughts on plans to offer a third dose to young teenagers?
Well, as a doctor, I will say that the evidence about receiving a third dose in adolescents is evolving. And the WHO and the EMA, they continue to state that delivering boosters to this population, the adolescents and teens, is lower on the priority list in terms of vaccination campaigns. But, you know, I'm going to talk now not as a doctor, but as a mom. One of my daughters actually got COVID in January. She had been boosted, or she had received 2 doses of the Pfizer vaccine and was 1 month out of being eligible for a booster shot. And I can tell you that for 2 months, she really suffered. She was extremely tired. She couldn't keep up with her schoolwork. And it was getting to the point where she was so exhausted and anxious and depressed, I actually had to talk to her about possibly taking a leave of absence from school. And I found it so incredible that I was having this conversation with her because, like so many other children around the world, she was not able to go to school for 2 years, online learning. Now she's finally in school, and I have to talk to her about possibly taking a leave of absence from school because of the symptoms of acute COVID. And she's a previously very healthy child. So all I can say is, you know, we've had more than 52,000 children and adolescents infected with COVID yesterday alone. 12,800 children have died due to COVID-19 around the world. We need to protect our children. The suffering that they go through is real. And just by telling you mom to mom, you know, if I could have gotten her the booster earlier, I would have. There's nothing worse that I could experience, I think, as a parent than watching my child suffer and then know that perhaps that I could have possibly prevented that. And so I encourage our government to consider rolling out boosters sooner for our children and for parents to make sure that their children are fully vaccinated against COVID-19.
Dr. Dan, I hope your daughter feels better now.
Thank you. She's much better, but it took a long, long time.
I can tell. All right, Dr. Dan, as always, thank you very much for your insights. Dr. Falzerano over in Canada, thank you for being with us today. And Dr. Kwok here in the studio, thank you for your thoughts.
Thank you.
Right, well, that brings us to the end of this edition. We'll be back with more coverage, same time tomorrow. That is Thursday. Join us then.